some initiatives of the government have been mentioned by Dr. Sibal, and some aspects have also been highlighted in the report that was presented just now. So today I would like to just once again remind you of the initiatives that government is doing and how is it trying to bring in accountability into those initiatives, some of which have been fleetingly mentioned. So as you are aware, the task given to the health ministry was that we have to ensure accessible, affordable and top quality health care for every Indian. This was the task, how we were tasked by the Prime Minister. Dr. Sibal mentioned the Ayushman Bharat concept, and that to some extent addresses the fragmentation issue that the report brought out, at least in terms of the policy, and then we go into the policy implementation. So the report speaks of the requirement for a continuum of care, and this is what Ayushman Bharat seeks to do. So as mentioned that the Ayushman Bharat tries to weave in the entire concept of primary, secondary and tertiary care, and to build in the systems which can ensure this. So basically, as you are aware, we have for the primary care, we have the 1 lakh and now the number is 79,000. The Ayushman Arogya Mandirs or the health and wellness centers. So these are to ensure the comprehensive primary health care, and as we go along I'll also tell the changes that we've done that some of you might be aware of. So you have the 1,79,000 Ayushman Arogya Mandirs. Then you have the traditional system, you have the community health centers, you have the sub-district hospitals and you have the district hospitals. And then you have these which address the needs for secondary care. And then for tertiary care, you have the medical colleges, or in the government sector, the Pradhan Mantri Jan Arogya Yojana empaneled over 30,000 hospitals. What links them? As the report brought about, the government's attempt to link them is through the Ayushman Bharat Digital Mission, which creates an Abha account for each one of us. And the latest count is around 80 crores odd people have the Abha IDs. Then you have the health professional registries, you have the health facility registries. The number of health records that are linked to these Abha IDs is fewer, it's about 79 crores. But that also highlights the fact that we need all the health care providers to come on this platform. And I think since we have the most thinking and the most committed healthcare providers here, perhaps you could go back and see if you are there on the Ayushman Bharat Digital Mission or not. And if you're not there, what is it that's holding you back? And we would be always ready to ensure that whatever other difficulties that you face are addressed, and we bring you on board our Ayushman Bharat Digital Mission, because you can be the flag bearers. In the ministry, we've ensured that all our aims, they are proactively using Ayushman Bharat Digital Mission, despite the fact that they have this pressure of public. Most of our hospitals are addressing aims, or whether it be Safdarjung, 15,000 to 16,000 patients a day. But still, all our aims across the countries are trying to become the flag bearers, are the leaders for the ABDM initiative. The other quality also requires good premises, and that's why government launched the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission to address the infrastructure gaps that we have, whether it be Ayushman Bharat, Ayushman Arogya Mandir or the community health center or the district hospitals. So this is what PM Abhim brought around. So now this is all being done under the flagship mission of the National Health Mission, and government has invested a lot over the years, and you might be aware that somewhere in 2014-15 we were investing about 24,000 crores in under NHM alone for the primary and secondary healthcare. Now it's grown to nearly 60,000 crores. And there have been several initiatives which have been launched. So whether it was the Ayushman Arogya Mandir, the free drug service initiative, the free drug diagnostic services initiatives, or the PMNDP. So a number of initiatives have been launched, but then the challenge is to ensure their quality control. Some of the outcomes that we see, which were mentioned by Dr. Sibal also, that the maternal mortality ratio in India is falling faster than global. The Indian decline was 86%, the global decline was 48% from 1990 to now. Similarly, for the IMR, the Indian decline is 73%, global is 58. I'm just comparing this to see that are we doing the right things or not. Similarly, for under 5 mortality rate, India's decline was 78%, global is 61%, and we have been called, thanks to many of you who would be also responsible for this, exemplar by the United Nations. So these are the measures that have been taken for this. Other milestones, you must be aware, the neonatal tetanus has been eliminated, or trachoma is no longer a public health problem. So these are some of the milestones I'm just mentioning to show that we are trying to ensure that we become better day by day. Now in the Ayushman Arogya Mandir that I spoke of, the problem of NCDs was also highlighted in one of these presentations. So many of you might know, but in 2018 we took the decision that we'll expand the scope of the primary health centers. Hence the name changed from PHC to health and wellness centers, where apart from your six primary functions relating to reproductive and child health and management of communicable diseases and OPD care, NCDs, screening of the 3 types of common cancers, emergency care, mental health care was added, and a community health officer was placed in these health and wellness centers in addition to the traditional ANM and the ASHA workers. The drugs and diagnostics were also expanded. When you expanded the services, you expanded the drugs and diagnostics. So I have the figures with me that for a sub-center, the drugs were 36, which are now 106. For a primary health center, 129, which are now 172. So diagnostics sub-center was 7, now it is 14. The primary health center, the diagnostics were 19 and now it's 63. This has increased the footfall tremendously in all our facilities. The NCD screenings, I'm carrying the figures with me just to cut. But when you do all of this, you need a robust IT system. So I may have expanded the drugs and diagnostics, but are these available at these facilities or not? Are people coming in for these services, and are they getting those services? So that's why there's a very robust IT system which has expanded over time, and we have the online real-time data available on multiple portals. We're now trying to bring it all together and using the Aadhaar ID as the identifier, the unique identifier. So you have the Ayushman Arogya Mandir, which tracks operationalization of the health and wellness packages. That is why the numbers are in 1, 2, 3s. I mean, exactly how many Ayushman Arogya Mandirs are operational today, I have the figures. You have the DVDMS portal, which many of you also might be using, so that if I get a complaint on the newspaper कि आज इस TB patient को TB मुक्त भारत अभियान चल रहा है, if the patient has not got his medicine and he was denied this, we can immediately check on the portal and see that was the denial because of lack of availability, or was it just negligence on part of the healthcare professionals? So that is the kind of data that we have today. He mentioned e-Sanjeevani. E-Sanjeevani is again something that is helping us expand the reach. So we also examine the 40 crore consultations that you mentioned. What categories are those consultations in? So are they really meeting the requirements that it has been set out to be? Again, Yuvan portal is another portal which has been which tracks everything to bring in more accountability, apart from giving the citizen the benefit of anytime access and anywhere vaccination. So these are the measures that have been taken by leveraging technology for the purpose. Then we come to the issue of the Indian public health standards. So 2022 we took out the Indian Public Health Standards, but we realized it was very difficult to reach out to all the states and UTs to ensure that even my Ayushman Arogya Mandirs rate themselves against the IPHS standards. And that was the time when the virtual toolkit was released. And as of today, out of a total of 2,09,910 facilities, 2,08,939 have at least assessed themselves. All are not giving all the benefits that they have to give. 86% say that they give the expanded package of services, but in terms of IPHS standards, now I know that how many percentage of facilities which are scoring 80 and above, which is a small percentage, but at least they all assess themselves and we know where they are, what is the gap that they have to meet. Similarly, government launched the National Quality Assurance Standards. We went, it's different from NABH, but we did it as per our requirements. And today, more than 41,000, I think 41,774 facilities have assessed themselves and are NQAS certified. So these were the things, and the NQAS takes into account whether it is service provision, or its infection control, the infrastructure, the clinical care, the support services, the quality management, patient rights and outcomes. And whenever we go on a visit to the states, we do visit both kinds of facilities, those which are NQAS certified and those which are not. And so these were some of the measures. Of course, you are all aware of whether it is Lakshya or the Muskan, which has been taken out, or the Sukashal portal on which states assess themselves against all these quality parameters that have been brought in. The Mera Aspatal, we are trying to popularize that also. Around that is a portal where patients can give their feedback. So over 11,000 facilities have onboarded themselves from these facilities. Again, I'm just taking the NHM example. They have onboarded themselves into this platform. Coming to another aspect, we spoke of CGHS, which will also now have a very robust form of the National Anti-Fraud Unit, which PMJ has. Again, it's an important thing from accountability. You mentioned, of course, the finer aspects of whether it was the right intervention or not. But as far as PMJ is concerned, we had the unfortunate case where people were operated for heart, where there was no need for heart. So now the system also gives out a flag alert. If the report says that you are the doctor, I'm not, that if the blockage is less than 30%, and if he has been operated upon, or if that is the pre-auth which is being sought. So at pre-auth stage only it sends an alert. So these are the ways that in this big, vast government system we are trying to bring in more accountability, more adherence to quality. But anyway, I shouldn't take more time. So these are some of the measures that we mentioned. As far as government expenditure has concerned, it is bringing about a decline in the out-of-pocket expenditure as a share of the total health expenditure. Obviously, health-seeking behavior, the more facilities you make available, happily that brings out more of a health-seeking behavior, and everybody's expenditure is increasing, but definitely out-of-pocket expenditure as a share of the total health expenditure is decreasing, mostly because of government and of course due to the insurance that people take. So these are just some of the things I wanted to mention, and I also wanted to bring out that it is a state subject, health. So government is intervening through missions like the National Health Mission, but it is essentially health is a state subject, and therefore it is always a pleasure to go to the best practice sessions in states and see what good things they are doing for better healthcare practices, and maybe you might be already having in one of your sessions. Otherwise, we can have sessions which share practices between the states and the federation. Thank you very much for giving me.
Thank you so much, Vidya ji, for a wonderful presentation.